Dr. Raj here with another episode of the Mohan Minute. Today I'm going to go over a very important topic, which is mommy makeover recovery. A lot of patients who come to the office wanting a mommy make, the biggest thing they're concerned about is the recovery because they're either working or they have children. So I'm going to break it down and summarize it very clearly. And these are more of my recommendations. Other surgeons may differ. So patients who have surgery, I tell them the first week, you just have to take it easy, chill out. You can do things you do day to day around the house, showering, walking around, having a meal, but you don't want to overdo it. And the key is to follow all the instructions, especially managing the drains and wearing the compression garment. Let's get to week 2. So my patients week 2, they start feeling a bit better. They don't need as much pain medication. I do allow some patients that really have to return to work to go back in a week, but typically I recommend they wait 2 weeks before returning to work. Also, after 1 week, I think it's okay to drive as long as they're not in too much discomfort. Now, we'll kind of fast forward into week 3. This is the time period where I tell my patients you can kind of do light duties and chores around the house if you're up to it and your drains have come out and you're not in too much discomfort. Of course, we all have to use our judgment and be careful and let our bodies speak to us as to what we can and cannot handle. But most of my patients around week 3 are able to do what I call light duties or chores around the house. And then by about a month, patients are feeling a lot better. This is kind of when I tell them you're not going to really need pain medications. You're going to feel more confident. You're going to start liking your results. But we want to still wait until the 6-week mark, which is when I clear patients to resume their normal exercise regimen or take part in wider activities. The main reasons for these restrictions, which at the end of the day are all it's going to be worth it, is basically I'm trying to cut down complication rates and any issues with healing. And I want to just ensure that patients have the optimal result. So my recommendation, whether it's my patient or anybody else's, always follow your surgeon's recommendations to a T to get the best results possible. Thanks for tuning in for another Mohan Minute.